This is what we call an OPG. This particular machine is a 2D panoramic X-ray, and we will show you how this works. We raise it to the level of the patient depending on your height, because the patient will be standing here. Is that your position? There's something that goes right in between your teeth. So for that, we will put in a protective sleeves. We have protective sleeves.
What's the use of a protective sleeve?
Basically, it's to minimize contamination around this area so that you don't have saliva around this place. Dominic, let's go ahead, put your gown. You need to wear your protective gown. This is called a lid apron. A lid apron protects the patient from radiation, especially around here, around the gonads and around the chest. So then from there, the patient will come here. Dominic, come right inside there. You need to bite on that and put your chin right here. Then I need to raise the machine up because Dominic is a bit taller. Tell me when you are comfortable. That's it? Okay, and then your head needs to be supported there. Okay, like that. Good. Then you can support yourself right there. So we have already input the details of the patient here. So there is now communication between this machine and this computer. So from there, we shall take the X-ray from outside the room. This room has to be inspected by the radiation board. They have to inspect it. This door also has a LED inside. This glass also has LED, so it can't allow any radiation. So, and the walls of the room, they are concrete. So anybody passing on the outside or even somebody passing outside here will not be able to be exposed to radiation. Even the patients working in the surgeries around are not exposed to radiation. Of course, we have radiation badges as well, which monitor the X-ray scatter radiation around the office. So these badges, they basically, there are some people who come and take them and go and measure how much radiation are we exposed to, and then they're able to advise us whether we need to make changes. So let's go ahead and take this. I'll press just a very simple button. You will see the machine right there going around the patient's head. You can see that. Yeah, it's exposing. It goes round. Okay, there we go, and we are done. Takes just like a minute. Okay, basically that's the X-ray, the one we've just taken. You can see some of the details we can see here. You have all the teeth, the lower teeth, the upper teeth. You can see the jaws, the lower jaw. We can be able to see the sinuses. So if a patient have got a bit of sinusitis, we would be able to see a bit of that. We have the temporomandibular joint, what we call the TMJ. If somebody comes complaining they have TMJ issues, we may be able to see that from this. So this is what we call a panoramic X-ray. You can see here, this patient here has a big filling and a root canal which has been done on that tooth. Doesn't have many cavities. The bone level is relatively good. So this is the beginning point. If we need any specific information, then from there we will go to the intraoral X-ray, which we are going to demonstrate very shortly. Thank you.